So what would a patient expect if they were going to have a sling? It's an outpatient procedure. It only takes me about 15 minutes to do the surgery, but they're in the operating room for about 45 minutes, and that's just because, we have to get them in there and get set up, and anesthesia has to do their thing, and prep and drape and all of that. We make a 1 centimeter incision under the mid-urethra. In fact, I only use my pinky, so I use a very small incision. Some people might make it a little bit larger, but it's not going to be anything the patient would notice any difference. I have my patients wake up in the recovery room with a catheter because I want to make sure they can urinate before they leave. So we do what's called a fill and pull. We'll put 200 cc's in their bladder when they're ready to go, pull the catheter. As long as they can void that out, they go home without a catheter. And I may have 1 or 2 patients a year that will go home with a catheter. And if they do, I just have them come back the next day and we get it out in the office, because most of the time it's just from swelling or some residual effects from anesthesia. 82% of people, this is based on the literature, on the TVT, are still 100% completely dry 15 years after having the surgery. So most people, what they get after surgery is what they keep. I do repeat slings on people occasionally. Most of them are people who have high risk of developing stress incontinence in the first place. People who do really strenuous activity, lift lots of weights, or have a very physical, demanding job. Or they gain a lot of weight, or they lose a lot of weight. Any of those kind of things can cause it to come back.